It's always interesting that such meetings are held on Friday and Saturday, and you have to take time off from your practice and everything else that you do.
That's a real
Use
mic.
this?
That's a fake camera mic.
Okay. That's a fake camera mic. Okay, there we go. That's a good start. Yes. Okay, so it's great and that you take the time off to come and visit with us, because I think at the end of the day, I'm hoping that what we could add is substance to what Letitia ended with, and that is, at the end of the day, most of you in the medical profession or in the health profession, what you really want to do, despite all these business aspects of the business and everything else, that you really want to sincerely provide quality care. And that is impinging right now because of all the things that are happening in the world, that your ability to provide quality care is really being discounted and rapidly diminishing. And Letitia also mentioned another point regarding supplementation. That's a worrisome thing in your world, because you really are not sure when your patient comes to you and present a product to you, you're really not quite sure how you're going to advise the person. And that adds on to your angst. And in fact, every week when you pick up your New England Journal, you see another article on why supplements are really bad for your patients, and so on and so forth. Particularly focusing on this technology that we call the biophotonic scanner. And we'll explain some of the science to you so that you have a level of comfort that fundamentally what we're trying to do is really answer the question, how do you really know whether your supplements work or not? At the very least, or at the very minimum, when you leave here, you will have some idea, at least we can measure. Because when you talk about science, you really don't talk about science. Science is really about measuring. Science is actually about basing your conclusions on data. Regardless of what field of science you come into, it's really all about measurement, isn't it? So, and that's what we're trying to do with the scanner. I was back in Hopkins visiting a friend of mine back there, and he obviously is in academic medicine. And he was telling me, boy, you know, even in academic medicine, we are being bombarded with all these questions regarding supplementation as well. And I sat down with this friend of mine, whom I postdoc, oh gosh, more than 30 years ago, before I joined the drug industry, that he actually thought that this was a good idea as well. So it is comforting to me that even a friend who pulls no punches managed to see the scanner as a viable technology in our world. So let's go through this very quickly. Fundamentally, Pharmanex in 1995 was co-founded, and I was one of the co-founders, together with another buddy of mine by the name of Michael Chang. He was trained, and he still thinks he is, a medicinal chemist. And Michael worked in a company whom all of you should be familiar with, and that company was Merck. And he was really responsible for their drug discovery programs. And on the other side of the fence, I was responsible for drug discovery at another drug company called Wyeth. And I sort of participated and worked in that company close to about 11 years. And over that period of time, I actually sort of contributed to the development of rapamycin, which is now the anti-rejection drug, and also to another non-steroidal by the name of Etodolag, and then finally another photodynamic therapy drug that's called sort of BOPP, which is specifically a selective brain tumor destroying type of molecule, which when you give it intravenously, it goes into tumor cells and not to the normal regular brain cells. And when you activate the light at a particular wavelength, it actually generates free radicals to destroy that tumor cell. So it's fascinating. But fundamentally, we got together with Michael and I, and we decided to really focus on natural products and natural ingredients to start this company that we call Pharmanex. And one of the first scientific advisors that we consulted with is this Professor Carl Gerasi. And he was a Stanford chemist professor. He started, in fact, he was a co-founder of Syntax, which right now it doesn't exist anymore in the Bay Area because it's now part and parcel of Roche. And once again, he has lots of experience. And sort of when we told him about our idea of starting a company based on the premise of converting and translating natural ingredients into dietary supplements, he sort of thought, well, it's a good thing. but make sure you don't develop snake oil. Fundamentally, use what you have learned in the pharmaceutical industry, i.e. good manufacturing practices, double-blind clinical studies and so on, all the things that you should do to make sure that you can substantiate that your product is safe and effective. Because if you look at it, if you in fact one day meet a physician or a healthcare provider, you will be expected to at least assure that individual that he is not going to do any harm. Fundamentally, within your Hippocratic Oath, there's this phrase about doing no harm. And at that point in time, back in '95, the supplement world was fraught with this risk and essentially, infused with snake oil and all sorts of supplements that don't meet the required standards of safety and efficacy. Because it's all a matter of ground up leaves being encapsulated, putting into a bottle, and then slapping on a nice looking label and call that a dietary supplement. And we didn't want to start Pharmanex with that premise, but actually overturn the apple cart, if you will, and say, why don't we do it a better way, and essentially focus Pharmanex on making pharmaceutical grade science-based supplements. That's how we started Pharmanex. So we started that in 1995 and raised about $46 million from 3 fairly sophisticated investors group. And that would be Fidelity, whom you all know. They're located in Boston, one of the largest, if not the largest mutual fund company. And they had a venture arm. We raised money from the Pritzker family, who owns the Hyatt hotel chain, one of the richest family in Chicago. And then the third one was J.H. Whitney, which to us was actually far more impressive than the other two, because J.H. Whitney is the oldest venture capital group in this country. If you look at the history of venture capital, you would see that J.H. Whitney was a pioneer in venture capital. He actually funded the railroad in the United States way back. So they have many, many years of funding startups, and for them to come in based on this story of making pharmaceutical grade science-based supplements was appealing enough for them to invest in a company was a bit of a reassurance for us that maybe we're on the right track. And then in 1997, we launched 5 products, and then in 38,000 stores in the traditional mass market channel, that would be Walmart, Walgreens, Rite Aids of the world. And then in 1998, we got acquired by New Skin Enterprises for roughly around $135 million. And that was the portal, if you will, that how I came into New Skin Enterprises. And I continued to learn about this business. And what we brought into New Skin Enterprises is this reality of making pharmaceutical grade supplements, this R&D engine, if you will, this ability to use science to translate what we know from all the historical documents about natural ingredients and how those ingredients, if we use the modern scientific method, we perhaps could actually add value to those ingredients. And we did that through this process that we call the 6S process. It's just an acronym. It describes the 6 steps that we use to manufacture and finally launch a dietary supplement in this company. Okay. And if you look at it, I won't go through each of those steps, but fundamentally, if you look at it, what we want to make sure that we do not use garbage. Because no matter how good your process and how good your science is, if you put in garbage in, you are going to get garbage out at the other end. So we wanted to make sure, as I said, through this 6S process, we wanted to make sure at the very minimum that our supplements are safe. It doesn't contain any toxic contaminants. We do not adulterate our products with steroids. We analyze our products with banned substances. All the things that we would think, in this 21st century that every company would be doing. Unfortunately, it is not the case. And you will hear many companies saying they're doing science, and it's difficult to really believe that particular claim because science in this day and age is really about using a multidisciplinary approach. It is about having close to about 100 scientists in the company, which we have currently, to be able to cover all the various scientific disciplines. We cannot just have chemists in our company because they don't know much in terms of biology or vice versa. So as you can see here, we have a whole array of scientific expertise in a company, and this is really the R&D engine that I'm talking about. And in fact, frankly, I'm really the mouthpiece for these guys. You ought to be meeting them, and you ought to be speaking to them, because don't take my word for it. Fundamentally, these are the folks who help to develop our products in Nu Skin Enterprises. And we do that in 3 R&D centers around the world. As you know, that the Chinese, in general, they have a very rich tradition, this so-called traditional Chinese medicine philosophy. And what we find from it is the fact that, yes, they have, and in fact it's quite well documented, they actually have the first original pharmacopoeia, if you will, written in Chinese. And we have lots of experts in China